Today we're starting off with something a lot of people don't like to talk about, losing someone they love. This week's cover of People magazine addresses a serious issue that everyone has to face at some point in their lives, how to deal with loss and grief.
The Travolta family lost their son Jet when he died from a seizure while his family was vacationing in the Bahamas. Of course, a very public display of grief here in the magazine this week.
So how do you deal with the loss of someone you love? Well, psychologist Ursula Weide is here to talk about how people deal with grief, and you have a very personal experience with this. You lost your husband pretty suddenly.
Yes, that's right. My husband died of a heart attack when he was 47 years old. And when I received that call at 5 o'clock in the afternoon, I was pushed into a completely different world. And having been a psychologist already at the time was no help at all. It was an emotional dimension that was so intense that unless we've been there, we cannot even imagine how traumatic it is.
How long ago was that for you?
It was more years ago than I care to remember, more than 10 years, and it took me a long time to be able to actually work with this in my practice.
So I guess there's a big difference between sadness, which we all experience, maybe even on a daily basis we could be sad about something, and then grief, which is more traumatic, right?
Yes, absolutely. And what the Travolta family is going through is obviously traumatic bereavement. There's another term for it, complicated grief, which I really prefer. Well, I prefer traumatic bereavement, but that is what this family is experiencing. Sadness is what we experience when we lose an elderly patient, an elderly relative, or a friend, a more distant friend, and it's integrated fairly quickly. 85% of all the bereaved are sad. No matter how badly it feels at the beginning, it's integrated fairly quickly.
So how do you know if you've gone too far in grieving, that you should be in the next stage of grieving, if you're taking things too long, things like that?
Yes. Stages, I really do not like the stages. The stages were conceived more than 3 decades ago, and the world likes to believe that there is an orderly course of grief, different stages with an end point. That does not happen. So when someone says to me, when one of my clients says to me, I'm still in the anger stage, then that person feels bad, because the person feels I have not made enough progress. I don't use the stages. We know that something difficult has happened to us when, for example, there's memory loss, we have difficulty concentrating, we feel like we're not ourselves. Many of our clients ask me, am I going crazy? And then I pull it together for them. It's almost like a package. I've never found a better term, but to explain to an adult on an intellectual level what traumatic grief actually is already helps them to get some sense of relief. And there can be all sorts of other symptoms. For example, I got into my car to go to a particular destination. 30 minutes later, I had no recollection how I ended up in a completely different place.
Wow. Your mind is in another place, right?
The mind is...
It sounds like since you've been through it yourself, you can really empathize with your patients.
Yes, yes, it is a natural part of me to do this kind of work. We're on the same wavelength.
That must provide a bit of relief for them to be able to go to somebody that, hey, you're really hearing my story and understand, you're getting it.
Yes, because they can talk to me exactly about how they feel and what they're doing, and not be judged or not get any kind of good advice like just get over it, move on. It just does not work.
People say you will move on with time, but when do you know personally that you might need some extra help if you haven't moved on? When you lose somebody like your husband or something and his clothes are still in the closet, when is it the right time to move on? Is it your decision, or if it's been some time, a year or two, do you need that push?
Everyone's different. Everyone has different coping skills. I was talking from the beginning on. That is one of my coping skills. What to do with personal effects, for example, again, is a very personal kind of issue. I still have some of my husband's effects. There really is no standard that tells you where you should be. It's very individual, and that's how I help my clients to manage their grief. We develop a very individualized approach.
So don't look at it as a timeline.
Exactly, exactly. I can give you my own timeline only as an example, but no one out there should take that for their personal prognosis. It took me about 3 years. Well, after 3 years, that was the last time when I fell into this big black hole, as I called it. And then it took me another 2 years to go out and to actually have the energy to make new friendships.
Interesting that you said that you still have some of your husband's effects.
Yes.
You know, is it kind of a knee-jerk reaction for some people who are experiencing grief to kind of rid the home of anything that might, on a daily basis, remind them of this pain that they're feeling?
Some individuals do that, but it's rare, because the home and everything that's in there represents the person, and that provides a sense of security. As difficult as it is, it provides a sense of security. And to say to a person, get rid of it as quickly as you possibly can so you can move on, again, shows a misunderstanding of the whole process the person needs to go through.
Would you say if someone is developing those kind of thoughts that they want it out of sight, out of mind, maybe they shouldn't get rid of the things that remind them of that person, maybe put it in another room out of sight, because if they get rid of it,
yes,
you know, a month down the line, I
exactly.
wish I didn't give away that sweater or something like that.
And you feel like that connection may be going too, along with the item.
Because you change rapidly as this process goes on.
Or you put things into storage, or you put some items in the garage. One of my clients put her husband's car collection, model car collection, in the garage, so it would be there, and she wouldn't see it every day. And moving on rapidly. See, the time frame, that's something that society doesn't really understand. Everyone's different, but it isn't a matter of 3 to 5 months. Society generally has this idea of 3 to 5 months, pull yourself together, move on, and that's it. And if you haven't moved on by society's definition, then there's something wrong with it. And that puts a lot of pressure on the person. The misconceptions in society about what complicated grief is after a traumatic death, as in the Travolta family, are humongous. And that is what causes a lot of difficulties for my clients. And what I do is I coach them to interact with an environment that does not really understand where they're at.
And when do you know when you need some medications, some drugs to help you?
Medication is a very good point. I generally do not think that even a traumatized survivor needs an antidepressant or anti-anxiety medication. In the beginning, the person doesn't know where up or down is. Everything is different. I feel differently, act differently, think differently from what I'm used to. There's something wrong with me, and it takes a while for me to see where the person is actually going. And most individuals really do not need any medication. Prescribing physicians often do not understand that a traumatized survivor does not respond to an antidepressant the way they're used to, because there is no pill in this world that can bring the disease back. And actually, medication can hinder the person from confronting reality more. We don't really have long-term clinical data about it. Traumatic grief is not something that society has liked to do a lot of clinical research about. So the first clinical studies really came out in 2000, and we've been around for hundreds of thousands.
Wow. Just starting.
So recently.
Just started.
We could talk all day about this.
Ursula Weide, thank you for coming in. Very important topic that a lot of people do care about. We appreciate it.
Very interesting. Thank you so much.